Good morning, everybody. Dr. Thompson here with Exemplify Health Center, your Wellness Way affiliate right here in Yorkville, Illinois. Happy Saturday morning. It's a little after 10:30. Apologize for coming on just a little bit late. Was seeing patients this morning, and sometimes it runs a little bit behind. You know how it is going to doctor's offices. So I hope you guys are having an awesome Saturday morning. I hope you guys caught the Dr. Patrick's ADP this morning. But today I want to go over some pretty interesting topics, especially when it comes to allergies and children. So if you guys are jumping on right now, go ahead and say hello. Please let me know where you're watching from. I always love to see where people are watching from all over the country. It's just so gratifying to see that so many people actually watch. So again, guys, I hope you guys are having a great Saturday. So today I'm going to talk about allergies and children. Why do your kids have so many allergies? This is the reason why I wanted to talk about this, all right? And let me give you a little bit of a backstory. So this actually happened at our school, in our school district, all right? My son was at school, and he drank some water, and he choked on some water. You know how it goes down the wrong pipe. And so the teacher, said, well, you're coughing, and we have to follow the Illinois Department of Public Health protocol, which means that you have to go to the nurse, and then the nurse says, well, if you've been coughing, you have to go home. You have to get a COVID test, and you can't come back until you have a negative COVID test, or you're going to have to stay home for the next 10 days, okay? Talk about just stupid policies, all right? And I understand that the school, is pressured to follow them. But do you guys understand how much stupid stuff is out there in regards to COVID-19 that doesn't make sense? And you actually question it, you ask questions regarding it, and you are gaslighted for doing it. Guys, trust your instincts, all right? Ask questions. So anyway, I posted a video about that. And let me change this just a little bit. There we go. And but there are so many people who said, yeah, those are stupid rules and blah, blah, blah. But one of the things that I noticed is that, that a lot of people had said, well, my child goes to school and they're scared to death to sneeze, or they're scared to death to cough because they suffer so badly with allergies. So it was absolutely incredible, and actually even eye-opening for me, to discover how many parents have children who do have seasonal allergies or specific food allergies. But the consensus is when I was looking at this, was literally how many kids have problems with their immune system and with allergies. Now, the thing is that what really was the most shocking was the fact that so many parents actually just thought that it was pretty normal. And if you actually look at it today, there's so many kids that do have allergies. I think it's now like almost 50% of kids who do have some kind of like seasonal allergy or have some allergy to something. That is common, yes, but it is absolutely not normal. So guys, please let me help you to understand why allergies are not normal, where in fact they're actually coming from, and really what you need to do in order to help build your child's proper immune responses so that they don't have allergies. Because remember, allergies, I'm going to tell you something, this is my opinion, but people who have a lot of allergies are going to tend to have autoimmunity, and it has to do with a couple of specific things that I'm going to talk about in just a second. So let's talk about allergies. Let's talk about why they happen. Let's talk about what you can do in order to actually start helping the immune system as far as attacking proteins that are ending up visible to the immune system by ending up inside of the body, okay? So allergies, like I said, are common. They're not normal. There's a difference between the two. Now, I'm going to tell you this, is that, a lot of times when we talk about, people is like, well, we could talk about my health, but don't talk about my child's health. And sometimes we get really upset when we start talking about health conditions when it comes to your children, okay? And I do remember this, and I want to tell you a funny story because I'm going to say this was probably about 15 years ago. So 15 years ago, I did a talk for 50 mothers who had young children. Okay, there was 50 women with young children there. And a lot of the kids had things like ADHD. A lot of kids had allergies. And you can just imagine that, if a woman has young kids, chances are they're probably already a little bit stressed out. And I was also really young, so I was maybe a little bit, didn't have as much emotional intelligence and maybe a little bit more brazen with how I spoke. But I remember we were talking about allergies, and I saw this woman was sitting in the front row. And like every time I started talking about this, I think I was talking because everything I was talking about was probably her son. And she just kept getting a little bit more uncomfortable, more fidgety. You could tell her facial expression. She was starting to get a little bit frustrated, a little bit angry. And I remember she just really loud, like just loud enough to where like I could hear it. She wanted me to hear this, but she looked over to her friend and she covered her mouth, but she pretty much just said it out loud. And she said, I wonder how well he's going to do when he has kids. As if like, you don't understand, until you actually have kids. I'm going to tell you something is that you don't have to have the experience for something to be right or not. And this is kind of the environment that we're in right now. Environment that we're in is we're saying like, hey, COVID-19 has a 99.9x% recovery rate. Okay. And people say, well, yes, but I know someone, so you really don't understand. Reality is, guys, is that facts are facts, science is science, and statistics are statistics. So I didn't have to have experience with children to know what was causing an allergy response in so many kids. So I remember, she said, well, you just wait until you have kids, and your kids are going to suffer with all of the same problems. But I'm going to tell you this, is that I have 3 kids, 14, 12, and 10. None of my kids have allergies. None of my kids have asthma. None of my kids have IgE food allergies. None of my kids have ADD or ADHD. And it's not because I'm a perfect parent. It's because I understand what allergies are and what to do to make sure that they don't have them. Now, this was not my experience for me growing up. I developed terrible allergies. I developed terrible asthma at about 4.5 years of age. I was given a bunch of antihistamines. I was given a bunch of asthma medication. I was given an inhaler. And I remember saying, why did I get this? And the consensus was, well, it's just genetic. And also I said, how long am I going to have it for? And it was for the rest of my life. So basically they're saying it's genetic. And then also, you're just going to have it for the rest of your life. And guess what? I did proceed to have it for the next 18 years because I believed the doctors that it was genetic. I believed them that there was no hope, there was no cure. And therefore, I never changed anything. That's the biggest lie that is actually said in healthcare, is that there's no hope, there's no cure, and it's just genetic. Because watch, when doctors can't explain something as far as why it's happening, we just give it this whole genetic, just blanket statement. Because you know what? It actually means that the doctor really doesn't have to do anything to help you other than just manage symptoms for the rest of their life. So remember this, guys, because I don't suffer with allergies anymore. I don't suffer with asthma. And remember, this was 18 years approximately of taking medications for allergies or asthma. So guys, this should actually make you really happy, because it means that you have the ability to be able to change the future when it comes to your kids. So again, I'm going to tell you, don't mistake common for normal. Just because allergies today are common, it doesn't mean that it is normal. Just because there's a lot of autoimmunity, and you can see that it is exploding, we're never going to call it normal. Cancer is way more common than it used to be. We're not going to call it normal. You would never go to the doctor and you would say, the doctor says, I'm sorry that you've been diagnosed with breast cancer, and you throw up your arms and say, you know what? I know 4 people who have breast cancer. I guess everybody's supposed to get it. No thanks. I think I'll just live with it. So we have mistaken common for normal, and it's not normal for someone to have allergies. And it's just like you would say if I decided that I was going to drive into Chicago, to the worst part of Chicago, and at 2 in the morning, I'm walking around with, holding $1,000 in cash, chances are I'm probably going to get mugged, maybe killed, who knows? But the reality is I would never say, oh, that's just normal. Yes, it's common if that would happen, but we would never call it normal. So guys, don't mistake common for actual normal, okay? And the reason why is that we're mistaking common for normal is because we literally do have an allergy epidemic. I want you to look at this. So this is actually coming from 1900 to 1940. Then you notice something at 1960 in which allergy reactions absolutely explode. So look at allergen-specific IgE. So these are IgE reactions. These are things that are involved with like anaphylaxis. So think like, Johnny who's got the peanut allergy or Johnny who's got the egg allergy at school literally comes into contact or even cross-contamination and they have this anaphylactic reaction. That has absolutely exploded. But then you also have things like rhinitis or having a chronic, runny nose, atopic dermatitis or chronic inflammation of the skin. And you also see that asthma has gone up. So you guys are going to notice that things like asthma, runny nose, IgE reactions, problems with the skin in kids, how since 1960 now over the last 60 years has absolutely exploded. And remember guys, if it's exploding that quickly, our genetics are not changing. There's something that we are doing that's absolutely irritating and stimulating the immune system. Actually not even doing that. The immune system is just doing what it's supposed to. So we got to ask the question, this can't be genetic. Is it something that we are doing that's actually causing this immune system response? So we have to start looking at it, and I would actually venture to say that even from 2000 to 2020, this has actually gotten worse. So just because everyone has it doesn't mean that this is actually something that is normal, okay? So I want you to look at this as well, because I want you to look at some other things that are now exploding since the 1960s. So I want you to look at this. I want you to look at multiple sclerosis in the green. I want you to look at Crohn's disease in the blue. I want you to look at type 1 diabetes, which is an autoimmune disease, Alzheimer's disease. I want you to look at celiac disease, thyroid disease, autism spectrum disorders, but also look at asthma in the red. And if you look at this and you can see from 1960 how it went up, but actually at 1980 how it then started to explode. And you're actually seeing things like immune system issues, allergies, autoimmunity, and even neurological disease that's taking place, and it's absolutely exploding, okay? Now remember this, is that we need to start looking at everything, every single cause, and science should actually say this. Science says we're going to investigate everything. We're not going to leave things off of the table, but you're going to notice that science is not science if you're not using the scientific process to look at everything and investigate everything. Remember, science has no agenda. Science says, well, it's definitely not this, because how many times that they're saying, you go to the doctor and you're saying, what's caused my child's asthma? We really don't know. We think it might be genetic. We might think it might be environmental factors. Well, think of this. It's not just your environment, how you're exposed to tree pollen or you're exposed to pet dander. It's also everything that we are doing that could be causing an immune system response. So let's talk about allergies. What on earth are allergies? Well, I went onto Google and I looked at the very first thing that actually popped up, and it comes from Healthline. Here's what they actually say about allergies, okay? So allergies are this. Allergies are an immune system response to a foreign substance. What on earth is that foreign substance? That foreign substance is a protein, okay? Your immune system responds to proteins that bypass your barriers and come into contact with the immune system, which is sitting within the blood, okay? Which is sitting within the blood or in the lymph system, okay? So remember, it is a protein. So what is a protein? So a protein can be literally anything. A protein can be a virus, okay? A protein can be a bacteria. A protein can be a food. A protein can be pet dander. A protein can be pollen. So you remember, the immune system isn't saying, oh my gosh, my immune system is freaking out. The immune system is just doing its job because it's coming into contact with proteins that don't belong within the body. And the body says, you don't belong here and we need to get rid of you. Okay? So when they say, well, it's just hyperactive, it's not hyperactive. And in fact, it's because you're coming into contact with a protein that doesn't belong in the body. So here's what Healthline says about your immune system. They say your immune system's job is to keep you healthy by fighting harmful pathogens, okay? So it does this by attacking things that could put your body in danger. Depending on the allergen, this response may involve inflammation, sneezing, and a host of other symptoms, okay? So that response with inflammation is really the body trying to neutralize that specific protein. How do we also sneeze? By getting rid of things that are irritating the body or something that could pose a threat to the body. That's why we cough. That's why we sneeze. That's why we vomit. That's why we have diarrhea. It's the way the body will immediately try to eliminate some kind of threat. But not only is it actually allergies, but you also will see allergies when it comes to the skin. If you're starting to see babies that are starting to develop allergies, things like eczema, allergic contact dermatitis, things like hives and things like that, this is an inflammatory response. And many times it has nothing to do with what the baby comes into contact with as much as it is what the baby is actually coming into contact with as far as what it could be eating or what it could be getting injected into the body that could be causing an immune system reaction at the level of the skin. Now remember this, where is most of your immune system sitting, okay? So let me make this easy for you. Most of your immune system is actually sitting where it needs the defense mechanisms, which is actually where it's coming into contact with your external environment. Does that make sense? So where do you think most of your immune system is going to sit? If it needs to neutralize things before it enters into the internal environment of your body. So where do you think you're going to have most of your immune cells? Things like neutrophils, things like dendritic cells, things like macrophages, which are part of your innate immune system response. Or where are you going to have antibodies sitting there to actually neutralize specific proteins, to actually tag them and tell the white blood cells, you need to go in and clean this area up. So where do you think that's going to be? And where that's going to be is anything that's exposed to the external environment. So I want you to think eyes, the nose, the mouth, the digestive tract, the small intestine, the large intestine, and even the skin and the lining of the lungs. So why do you think that when a child starts to have some kind of immune system response or allergy type response, why do you think it involves things like breathing and the lungs? Why do you think it many times in kids involves the skin? Why do you think it involves the gastrointestinal system? Because this is where the immune system is actually sitting. Now, which begs the question. It begs the question is then what is then happening to my child's barriers that are allowing these proteins to come in and come into contact with the immune system? So many times when we have allergies, we just say, hey, you know what? Let's just give some treatments for it. And this is what the treatments do, because when I was growing up, many times what I would take, especially this was every spring, this was fall, is I would take something known as antihistamines. Okay, antihistamines. Well, what are histamines? Histamines are actually a chemical that's given off by specific immune system cells known as granulocytes in response to a protein. And so it will give off a histamine reaction. That histamine reaction, the histamine response, actually acts as almost a scent to where other white blood cells can come and to start to clean up the damage or start to do something known as phagocytosis. So it just will start to clean up that damage, and the histamines are basically like a chemical messenger to say, hey guys, come over here, here's what I found. But those histamines will then amplify this reaction. But guess what histamines also do? Because I remember when I was taking these antihistamines, there was a side effect by these histamines. You know what the side effect is? Look at any antihistamine and look at on one of the warnings. One of the warnings is, please don't operate any heavy machinery or heavy equipment because it was going to make you drowsy. So it's going to make you drowsy. The reason why is because histamines also excite the brain. Let me say it again. Histamines excite the brain. So an antihistamine or blocking the release of histamines is actually going to settle the brain down. Now let me give you a clinical correlation here. This is going to blow you out of the water. How many kids do you know that are suffering with ADD, ADHD who also have a lot of allergies? Maybe the problem is an irritated immune system and it's not a problem or some kind of genetic issue or dysfunction happening in the brain. Maybe the brain is on fire because the histamines are always exciting the brain. I want you to think about that. If you know anybody right now with ADHD or ADD, ask them this question, share this video right now and say, hey, does your child also have a lot of allergies? And the problem is not that they have ADHD. The problem is that they don't have some kind of issue that's going on. It's that their immune system is absolutely irritated. So what are the medications? Antihistamines, things like Benadryl, which block a histamine release. Corticosteroids. What do corticosteroids actually do, guys? It literally knocks out the immune systems. People with autoimmunity are taking corticosteroids. Guys, long-term corticosteroid use is absolutely devastating to your body. And the reason why is that you will see an adaptation take place of things like lower thyroid function. You're going to see lower release of fertility hormones. You will, if you want to wreck your menstrual cycle, if you want to wreck the development of a young girl's menstrual cycle, or even the ability to be able to have it, give them a bunch of corticosteroids. You will see so much pituitary gland dysfunction. It is unbelievable, which is why a lot of women who come in, they have autoimmunity and they're taking corticosteroids. It's like now what you see is you have the initial autoimmune response, but then they have things like Addison's disease. Then they have thyroid disease. And then they're on birth control because of their menstrual cycle. And it's all tied together mostly to just the treatment of it. So you have things like Zyrtec, Claritin. You have things like decongestions. How do decongestions work? Things like Sudafed, for example. So how does that actually work? Well, really what they do is they causes blood vessel constriction, and if you cause blood vessel constriction, will clear up a runny nose because you can't get the vascular supply to it, which then will cause the runny nose. But guys, just remember this, is that the runny nose is actually the body trying to clear out that allergy reaction, because within the actual nose and the sinuses is something that's known as IgA, which is an antibody, in order to then tag some of these foreign proteins. Now, how about Singular, okay? Because we throw around Singular like it's nobody's business. Just take some Singular if you have allergies. Here's what they actually say. Singular should only be prescribed if there is no other suitable treatment options. This is because it increases your risk of serious behavioral and mood changes, such as suicidal thoughts and actions. So if your doctor is throwing around Singular for your child or for your teen, have they, number one, tried everything else? I guarantee it, no, they haven't. Because how many of them said, you know what, maybe we should start looking in a different direction. Maybe we should refer you to a Wellness Way doctor. I have yet to get a referral from an MD. Let me say that again. I have yet to get one referral from a medical doctor. And this is also true with even the chiropractic aspect of it. This is also true when it comes to autoimmunity. This is also true with people with metabolic syndrome. I have yet to get even one. Now I want you to think of this. If I took an x-ray on someone and I saw cancer, And I said, you know what, I'm not even going to refer you to a medical doctor because, you know what, they just don't, you know, if you look historically, they don't do very good with cancer treatment. You know, most people die anyway, so I'm just not going to say anything to the patient. I would get sued for malpractice. However, doctors never get sued for malpractice when they know that there's a better way and they refuse to take someone outside of a medical system that has failed this child, and they have no consequence for that actually happening. So did they put your child on Singular as if it was just nobody's business? And meanwhile, what's happening is severe behavioral changes, depression, suicidal thoughts, anger, agitation, rage. And then what happens is then, well, they just give them an antidepressant, or they put them into counseling, or even, you know, some of the worst things can actually happen. So I want you guys to understand your immune system. And I'm not going to go into every immune system response, but I want to keep it super simple for you. Is that if you understand your immune system, you understand that one of the most important things to keeping your immune system strong are your barriers. Your barriers. Well, Dr. Nate, what do you mean by your barriers? Well, remember, an allergy is just a response to a protein that has bypassed a barrier. That's all that it is. So where do we have barriers? We have barriers in our skin. So our skin are our barriers. You have a lot of immune system cells that's sitting right underneath the skin. So your skin is a barrier. So how are you doing actually with the health of your skin? A lot of things that we do when it comes to our skin, we actually dry out our skin versus having a nice oily barrier that actually will have a certain acidity that actually keeps bacteria in check when it's sitting on the skin. You also have barriers in the sinuses. You have barriers in your eyes. You have barriers in your nose. You have barriers in your mouth, your esophagus. You have barriers lining the gastrointestinal system. Remember this, your gastrointestinal system is completely separate from the internal environment of the body. You have a barrier that's actually sitting right there. So what happens then if you have all of these allergy responses? Something you've done can actually destroy the barriers, or maybe you decided that you were going to bypass all the barriers and maybe just, I don't know, inject something straight through the skin to then get it exposed directly within the bloodstream. I want you to think about that. So if you look at just when it comes to your gastrointestinal barriers, so when these barriers start to break down, when these barriers get inflamed, when those junctions within the gastrointestinal system aren't healthy anymore and they start to tear apart, then what happens is that it will start to allow more things to bypass your gastrointestinal barrier, which then will show up within the blood, which then the immune system has to handle that foreign protein. Now, this is actually true when it comes to food allergies, especially. So what will actually damage your gastrointestinal barriers? Well, always being in the fight or flight, stress. So you have mental stressors, you have physical stressors, you have chemical stressors. What about toxins that destroy the barriers? Guys, the number one thing I'm going to tell you is going to be known as glyphosate or Roundup, and it's in your corn, it's in your wheat, it's in your soy, which if you eat the standard American diet, you're exposed to it every single day, and so is your child. What about food particles? So undigested food particles. So you're not breaking your foods down, which means if you're stressed, you don't produce enough stomach acid. Or maybe your pancreas isn't working as well, can't break down actually some fats and can't break down some carbohydrates. Maybe the liver's not working well. You don't have the gallbladder and the bile in order to basically break down and emulsify the fats, which is actually needed to keep your skin barriers strong. How many women have gotten their gallbladder out and they notice that their skin gets very dry, irritated, red, and itchy? Also drugs, antibiotics, other things like aspirin, Tylenol, any kind of non-steroidal drug can do it. Pathogens, or any kind of organ malfunction that's going on. All of those things, guys, what happens is if that barrier gets compromised, it will then start leaking things through, which, yes, are proteins, which then you have an immune system response, and the body says, we have to handle it, inflammation, and yes, you can have an allergy response. So this is why you can have kids who have an IgE food allergy, things to like peanuts or eggs or shellfish or something like that. But that's just actually a small portion of your immune response. It's only 0.002%. But guys, the thing that you actually are having the highest inflammatory or allergy response is actually is known as an IgG reaction that is not associated with things like runny nose, anaphylaxis, or anything like that. And guys, this is why we always say, if you have so much proteins that the immune system has to handle, this, as a youngster, this is a recipe for down the road of having autoimmune reactions taking place. So, what do you think? Where do you think I'm going with this? It's all about the barriers when it comes to allergy. So, we always think, when a child, for example, is having a lot of allergy reactions, really what they do is they just do what's known as a scratch test. So they might do a scratch test to foods, they might do a scratch test to environmental allergies, and no, I'm not opposed to doing that, but really when you're doing and looking at an IgE reaction, which is actually what they're shooting for, you're really only looking at 0.002% of your immune system. So this is called IgE, this is a type of antibody. This right here is called IgG, which is actually 80% of your antibodies in your body, and most of them is actually responsible as sitting around the gastrointestinal system. So this is actually involved with things like phagocytosis, things like inflammation that you actually feel systemically and things like that. So this is why, guys, why? Yes, for kids who have allergies, we do test IgE food allergies, but we also test IgG food allergies. And the reason why is guys, this is actually most of your antibodies that are being produced that are then signaling or telling the blood cells, hey, you have to go clean this area up. So I want to ask you a question, because the only way that you can have an allergy response is to actually be exposed to proteins. So think of this. What would cause someone to be exposed to proteins that have bypassed the barriers? So I want to ask your question right now. I want you to be completely honest with yourself. If your child has allergies, ask yourself, when did the symptoms start? When did they start? Okay? When did they start? I'm going to give you a perfect example. 3 months. Did they start at 3 months? Yeah. I noticed that there's some changes in my child's skin. The skin was really irritated at 3 months. Well, you know what the number one thing that medical doctors, pediatricians actually are recommending for children at 3 months? And you know what they tell them to do? Start giving your child solid food like rice cereal, for example, at 3 months. Now, this was a long time ago, 14 years ago approximately, and I remember for our oldest child, because everybody said you're supposed to give your child rice cereal at 3 months of age, my wife decided to give my oldest child some rice cereal. And boy, he loved it, because it's just sugar and there's some rice protein in it. And so immediately within like 1 or 2 days, he started to develop eczema all over his skin. And I was like, wait a second here, what's going on? I was like, honey, what are you doing? Why does he have eczema? Are you putting something on his skin? She says, no, I just started giving him rice cereal. All right. Obviously, we had communication problems because I said, don't give him rice cereal. Oh my gosh. And the reason why is this, guys, is that for a baby, their gastrointestinal barriers are wide open. And this is not some kind of like faulty machinery, faulty design. This is supposed to happen because a baby is supposed to solely have breast milk from about 0 to 12 months of age. Those proteins are okay to pass through the barriers because they're moms, because there's things like antibodies and white blood cells and things like that mom is lending to the baby to help their immune responses. And so the gut is wide open in order to be able to accept that, and it's supposed to be wide open. You give a baby rice cereal at 3 months, you are now exposing them to proteins that do not belong in the body. And I remember we took him to a old school pediatrician that was just not traditional in the least aspect, was very alternative. And he looked at my mom, or not my wife, and he said, "What are you doing? You never give rice cereal to a 3-month-old. They need breast milk only, case closed, start doing that. He doesn't even need to put anything on it." And so went back to breastfeeding exclusively, and the eczema cleared up within about 5 to 7 days. So you should not have any kind of food, ideally for the first 12 months, because that's when the barriers will then start to develop. And I know when I say this, I'm going to have a lot of angry moms at it, but just remember, I'm not attacking you as a person. We're saying make it better for your child, please. By the way, if you have your identity tied into who you are as a mom, then we need to talk, because if your identity is tied into you being a mom, then you will be stressed for the rest of your life. You will be stressed at when your kids mess up. You will be stressed when your kids aren't perfect, and your identity is not what you do, it's actually who you are, by the way. So did it happen when you're 1 year of age? Did the symptoms start? Well, I want you to think of something, is that a baby can actually start to produce antibodies on their own depending on the type of antibody. Usually that production will actually come up at about 6 months of age. So after 6 months, I want you to think of something at 1 year of age of what we are doing and where we are taking our children. We're taking our children to a pediatrician who is then weighing and measuring them, but really the reason why you're taking them to the pediatrician is to actually give them a vaccine. And I want you to think about it. What does a vaccine do? It triggers an immune response by bypassing all of the barriers. So remember, most of the immune system is sitting around the barriers because a normal infection has to go through the barriers. We are spiking an infection by bypassing the barriers and going straight into the blood that is relying on an antibody response. I want you to think of this. Think of what some of the other ingredients in vaccines that could be that are then bypassing the barriers and then exposing the immune system to things like peanuts, for example. Can you say peanut oil? What about eggs? What are some of the vaccines grown in? They're grown in egg culture, like the flu vaccine, for example. And guys, when we do food testing, I want you to think about it, that most things that we are seeing are things like eggs. We're also seeing things like peanuts. We're seeing nuts. We're seeing things like that. And then on top of that, we're also seeing dairy. Well, when are we giving our children dairy? We're giving them at 3, 4, 5 months of age, and we're actually exposing them at a very young age, and we're actually spiking an allergy response. Then you have things like 18 to 24 months. So when did you start to see it? Because that's when we're getting our next round of vaccines again. So if that didn't do enough of an allergy response, we're just boosting it again. And then pre-K, we also get another round of those. In fact, that's when I started to spike all of this asthma and these allergies, was literally within about 3 to 4 days after having my pre-kindergarten vaccines. That's when it started. But the other thing that can happen too, guys, is what if it happens later in life? So some people actually will come to me and are like, I've never had allergies, but now all of a sudden I'm 40 years of age and I'm developing like seasonal allergies or asthma responses and things like that. Well, a lot of times what can happen is as you get older and you are have a poor lifestyle, then those barriers can start to become damaged and compromised, which will then start exposing proteins to the immune system that's just trying to clean up things that actually don't belong there. So I want you to look at this, guys. Remember, what does science say? Science is the process of discovery. Science doesn't have an ego. Science doesn't have an agenda. Science doesn't have poor self-esteem. Science says we will look at everything. We will look at everything from an unbiased perspective. But I find this interesting. I find it interesting that when you look at the different types of allergy responses and also autoimmunity, actually looks very similar to what happens with a child's vaccine schedule history. Okay? And my opinion is that why we have so many allergies is because of how we raise our children. We give them food before 1 year of age. We inject all of these proteins into their body without having a proper immune system barrier response. And then after that, we give them a lifestyle that is not conducive to healthy barriers. With the foods that we eat, the stress that we put them under, I mean, guys, look at it. It's so much different now than it was 40 or 50 years ago. Can I get an amen, please? So, what on earth do we do? What on earth do we do? Okay, someone asked me, what's your protocol for allergies, or how do you heal allergies? I want to be perfectly honest. I don't have a protocol that works for every single person. Every single person is different. Every single person is unique because every single person is going to have different stressors. But I'm going to tell you something. If your child has allergies, or maybe you have allergies, the first thing that you need to do is you need to consider this. What are my child's physical stressors? What are their chemical stressors? Heck, what are even their mental stressors? Because all three of them will actually put them into what is known as fight or flight, not in rest and digest. And when your child is in fight or flight, good luck trying to have a healthy immune response. Good luck trying to not constantly be irritating that immune system. Good luck. It's going to be impossible. So what do we always say when we say tested? Well, I will tell you this. First thing that we do is, here's a child who has not only ADHD, but terrible allergies. And look at that neck. He's 4 years of age, and he has had, obviously, birth trauma. That birth trauma has put him into fight or flight, which is not conducive to having healthy barriers, healthy digestion. And then, of course, then you'll see that, early food, before 1 year of age, lots of vaccines, and immune system is absolutely going haywire. So yes, even for children, we x-ray them and we actually will start to adjust them and correct the spine of the nerve system, because guess what? The nerve system and the immune system are really one and the same. It really is. Number two, what you got to do is you got to test the barriers. IgG, IgE food allergies. Sometimes we even do neurotransmitter tests, on these kids. And then you got to discover what's happening. Stool testing too. What do you got to do in order to start healing those barriers? How do you heal the barriers so that the proteins aren't getting exposed to the internal environment of the body? And then the last thing is that you need to start regulating the immune system response. So you need to start feeding the immune system. You have to know what that immune system is actually doing. Heck, you could even do like a complete blood count and look at the white blood cells and look at the different types of white blood cells. And a lot of times I've looked at that test and I say, why are you high in this cell all the time? Does your doctor talk to you about this? Why are you high in eosinophils all the time? They're like, they never said anything. And I'm like, this is a specific allergy type response. There is something that is really irritating your immune system right now. And I've seen people even going to functional medicine doctors for 2, 3, 4 years, never getting better because they're not actually addressing the primary stressors. So guys, there is no protocol. There is no just do this. There is no, if you just do this, this, and this, everything's going to be better, because everyone is different. Everyone is unique. You can't stress that enough. So anybody who's saying, do my protocol, or can we do something with 20 people all at once and do the same protocol? Guys, it may work for 2 or 3, but for a lot of them, it's not going to work, because you need to test and you need to figure out what the biggest triggers are as far as the immune system and allergy, and how to get that to start to heal and start to get them to normal. Because I'm going to tell you this, guys, the normal physiological response of your child's body is growth and healing. Let me say that again. The normal physiological response of your child is growth and healing. It is not sickness, illness, and disease. It's not that way. And whoever told you that is either lying to you, or they actually don't know and they're trying to absolve themselves from all responsibility. So I'm going to tell you something. If your child right now, I want you to pay attention, if you are from the Yorkville area, for around the area, you may be watching this from Yorkville, Plano, Sandwich, Oswego, Aurora, Naperville, DeKalb. I don't know where you guys are from, but if you are from the area, then what I want you to do, and your child is suffering, what I want you to do is reach out to us either via messenger or call our office. 630-553-6149. You'll see it on the front of our page. And please, please, please schedule your child so that they can get properly tested. Because I'm going to tell you something. Back when I was growing up, we just didn't know. We didn't know that there was a better way. And I suffered. I suffered so, terribly. But you know what? I'm thankful for it. I'm thankful for everything that I went through. I wouldn't change it for the world, because the reason why is that it sparked a desire to figure out why. It sparked the interest to figure out why. And most importantly, it helped me to develop empathy. Because if your child is sick and they have allergies and asthma, they have things like ADHD, I'm going to tell you something. I know exactly what you're going through. I know exactly what your child is going through. But you know what? Do something to help give them a tremendous life and a tremendous future. Get tested, heal the barriers, and start to work with that immune system. And I'm going to guarantee you this: you remove the triggers, the natural process of the body is health and healing. That's just how it works. So guys, hopefully that makes sense for you. And also, what can you guys do? Here's a tip. Here's what you can do. Even before you get tested, there are things that I know are going to help, especially with people who have an allergy response. Two of the biggest things that will help are going to be, number one, Albizia. So number one, Albizia will help. Number two, I know that you probably can't see that very well just because of the lighting, but also nettle leaf. So nettle leaf, especially for things like seasonal allergies, will help. Seasonal allergies, especially with kids who have specific IgE reactions. But those two things are absolutely awesome when it comes to allergies, okay? Now, do I want you to be on this forever? No. These are things temporary to help dig you out of a hole while we start working on causes. Here's our business model. I don't want to see you in the same fashion for the rest of your life, number one. Number two, I also don't want you taking a boatload of supplements for the rest of your life, because if we truly are working on causes, then people, as they start to come up into getting better and starting to heal, their supplement list should go from here all the way down to here. And if people are following through, then obviously, then they're doing the right things and their body is actually healing.